Welcome to today's lecture on restless leg syndrome, RLS. In this comprehensive session, we will delve into the epidemiology, pathophysiology, clinical presentation, diagnostic criteria, differential diagnosis, medical history, physical examination, primary and secondary RLS, treatment options, pharmacological management of RLS-associated conditions, management of RLS during pregnancy, long-term complications and outcomes, RLS in pediatric populations, and the latest research advances and emerging therapies in RLS. Restless leg syndrome, RLS, is a common neurological disorder characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. It affects both the quality of life and sleep patterns of individuals. Understanding the epidemiology of RLS is crucial in identifying risk factors and implementing preventive measures. The prevalence of RLS varies across different populations, with a higher incidence in Western countries. It affects approximately 5 to 15% of the adult population. Females are more commonly affected than males. RLS prevalence increases with age, with a peak incidence in middle-aged and elderly individuals. RLS has also been found to have a genetic component, with familial cases observed in around 40% of patients. Restless leg syndrome, RLS, is a condition for which the exact cause is still not completely understood. However, there are certain mechanisms that play a role in the development of this syndrome. One important factor is the dysfunction in the transmission of dopamine, a neurotransmitter in the brain. Another contributing factor is iron deficiency in the body, which disrupts normal nerve function. Additionally, alterations in the regulation of circadian rhythm, our body's internal clock, and abnormal processing of signals in the central nervous system also play a role in the development of RLS symptoms. Individuals with RLS typically experience uncomfortable sensations in their legs, described as creeping, crawling, or tingling, which are relieved by movement. Symptoms worsen during periods of rest or inactivity, particularly in the evening or at night, leading to sleep disturbances. The International Restless Leg Syndrome Study Group has established diagnostic criteria, including the presence of an urge to move the legs, worsened symptoms at rest, symptom relief with movement, and worsening symptoms during the evening or at night. In the differential diagnosis of restless leg syndrome, RLS, it is essential to consider other conditions that can present with similar symptoms. These conditions include peripheral neuropathy, which refers to damage or dysfunction of the nerves outside the brain and spinal cord, and peripheral vascular disease, which involves the narrowing or blockage of blood vessels in the limbs. Arthritis, characterized by joint inflammation, myalgia or muscle pain, and akathisia, a movement disorder associated with a feeling of inner restlessness, should also be considered. It is important to carefully evaluate the distinguishing features of RLS to ensure accurate diagnosis and appropriate management. A comprehensive medical history and physical examination are essential in evaluating patients with suspected RLS. Important elements include assessing the duration and severity of symptoms, identifying any potential triggers or exacerbating factors, reviewing medication use, and ruling out other medical conditions that may contribute to RLS symptoms. Additionally, a thorough neurological examination may help exclude other movement disorders that can mimic RLS. RLS can be categorized into primary and secondary forms. Primary RLS, also known as idiopathic RLS, occurs in the absence of any underlying medical condition. Secondary RLS is associated with underlying conditions such as iron deficiency anemia, end-stage renal disease, pregnancy, or peripheral neuropathy. Differentiating between primary and secondary RLS is crucial for effective management and treatment. The management of RLS involves a multidisciplinary approach and aims to alleviate symptoms, improve sleep quality, and enhance overall quality of life. Non-pharmacological treatment options include lifestyle modifications, such as regular exercise and avoidance of substances that exacerbate symptoms. Pharmacological interventions, including dopamine agonists, benzodiazepines, alpha-2 delta ligands, and opioids, can be used to manage moderate to severe RLS symptoms. Restless leg syndrome, RLS, can often be associated with other conditions, such as iron deficiency anemia, neuropathic pain, or sleep disturbances. Patients who have RLS may require additional medication to manage these related conditions. Treatment options may include iron supplementation for anemia, analgesics for pain management, or sleep aid medications to improve sleep quality. The choice of medication will depend on the patient's specific characteristics and underlying comorbidities. It is important for healthcare providers to assess each patient's individual needs and tailor the pharmacological management accordingly. Pregnant women with RLS face unique challenges in managing their symptoms due to concerns about the safety of medications during pregnancy. Non-pharmacological approaches, such as regular exercise, leg massages, and compression stockings, are typically recommended as the initial management strategies. However, in severe cases, pharmacological interventions may be necessary, with careful consideration of potential risks and benefits. RLS can have significant long-term consequences if left untreated or uncontrolled. Sleep disturbances resulting from RLS can lead to daytime fatigue, impaired concentration, and decreased productivity. Moreover, individuals with RLS are at a higher risk of developing anxiety, depression, and cardiovascular diseases. Early diagnosis and appropriate management can help prevent these complications and improve clinical outcomes. While RLS is commonly seen in adults, it can also affect children and adolescents. Pediatric RLS presents unique challenges, as children may have difficulty describing their symptoms accurately. Diagnostic criteria and treatment options tailored for pediatric RLS have been developed to ensure optimal management and improved quality of life for affected children. Ongoing research aims to further elucidate the underlying mechanisms of RLS and develop novel therapeutic strategies. Recent studies have explored the role of genetics, circadian rhythm regulation, and neuroinflammation in RLS pathophysiology. Emerging therapies, such as transcranial magnetic stimulation and targeted medications, hold promise for more effective and personalized treatment approaches in the future. In conclusion, restless leg syndrome, RLS, is a complex neurological disorder with significant impacts on sleep and overall quality of life. By understanding its epidemiology, pathophysiology, clinical presentation, diagnostic criteria, differential diagnosis, medical history, and treatment options, healthcare professionals can provide comprehensive care to patients with RLS. Ongoing research and emerging therapies offer hope for improved outcomes and quality of life for individuals living with RLS. Thank you for attending today's lecture, and I encourage you to further explore this fascinating field.